We are talking health this morning. We've got Greenwood Leflore Hospital here with us, and it's National Stroke Awareness Month. This morning, I'm joined by Dr. Ravi Pande. He's a neurologist with the Greenwood Neurology Clinic. Good morning, Dr. Pande. How are you doing?
Good morning. How are you?
I am good. May National Stroke Awareness Month, and you are specialized in this. Can we talk about this a little bit this morning? Can you tell me what a stroke is?
Yes. A stroke is basically a disruption of the blood supply to a part of the brain. Okay, it can be due to any reason. If it is due to a blockage of the artery, it is called an ischemic stroke. And if it is due to blood bleeding in the artery, it is called a hemorrhagic stroke. You know, stroke is now the 5th leading cause of death in the United States and the #1 cause for long-term disability.
Let me ask this. If somebody thinks they're having a stroke or is in that place, what do they need to be doing?
Okay. The chain of events favoring a good outcome for acute stroke is that it should start from recognition of the stroke. How to recognize that somebody is having a stroke?
And that's a big question.
That's the critical issue. Now, there is a message which is called the FAST message, F-A-S-T, FAST message. F means face. If the face is droopy, A is arm. If the arm falls down or drifts, S is your speech is slurred. Then T is that is the time to call 911. It is very important to recognize this. If any of these symptoms are present in a patient, you need to call 911 right away, because time is brain here. Each minute of delay causes damage to millions of neurons. So that's important, and it is important because EMS comes and they take you to the highest level of care of hospital, where you can get the treatment
that you need. Let me ask this, Dr. Pande. Let's say somebody suffers a stroke. What is life like after that? You know, and what are the important steps to take after you've had a stroke?
It depends. That's where it is critical, because I have seen when they come within 3 hours to the hospital, to a stroke-ready hospital, and they are given a very strong blood thinner, their outcome is very good.
Wow.
And the standard of care nowadays is that every patient who comes in with a stroke should get that treatment. Then all these studies which have been done, in the next 3 months, their outcome is better.
Wow. Well, and just goes back to what you said, time. If that
time is brain, just remember that. And just remember FAST, F-A-S-T, face, arm, speech, and T is time to call 911.
Fantastic. Dr. Pande, thanks so much for being here. This morning, we want to remind people that May 25th, Stroke Awareness Day at the Greenwood Leflore Hospital. They're going to be having an event at their conference center over there. It's going to happen in room 1A, and you'll have an opportunity to have free screenings, guest speakers, and plenty of fun activities. You'll get to see Dr. Pande and ask a lot of your questions can be answered. Again, that's May 25th at the Greenwood Leflore Hospital. Dr. Pande, again, thanks so much for informing us. We appreciate it.
Thank you.
Stay with us. We've got more coming up after the break. We'll be right back.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.